The next biobank is Complex Wounds at Manchester. This bank was set up by Dr. Adam Reed and Dr. Jason Wong, both senior clinical lecturers in plastic and reconstructive surgery. The Complex Wounds Biobank received a Translation Manchester Access to Expertise Award in 2020, which is currently funding a research nurse at the Manchester Foundation Trust to facilitate the collection of tissues from 200 patients over the next year. Adam has kindly sent us the slides for today, which we will go through now. The Complex Wounds at Manchester Biobank offers a non-for-profit service to researchers within the University of Manchester, other academic institutions, NHS trusts, and private industries. The biobank aims to provide researchers with access to samples from patients with a variety of complex wounds, including but not limited to pressure ulcers, diabetic foot ulcers, venous and arterial leg ulcers, complex traumatic wounds, iatrogenic wounds due to surgical complications, wounds secondary to infection, acute and chronic burn wounds, and healthy surgical wounds. Ethical approval has been granted for collection of the following types of samples from patients with complex wounds: tissue normally discarded during surgery or dressing changes, wound fluids taken as swabs, blood samples, and wound or healthy tissue biopsies. In addition to offering wound samples for biomedical researchers, the biobank team collect routine, anonymised clinical data related to the wound and patient demographics for analysis and comparison to clinical phenotypes. Routine samples are stored frozen at -80 within the MFT Biobank on the Oxford Road site. Jay Brown is the MFT Biobank Manager and will present next in this series. Fresh samples are also available on request through discussion with the Complex Wounds at Manchester team. The team also offer a responsive service that caters to specific researchers' requirements and is able to offer bespoke sample collection to meet project requirements. We strongly encourage contacting the team early on in project design to discuss feasibility, cost, timescales, and for the collection of prospective samples. The point of contact for the Complex Wounds at Manchester Biobank is Bradley Talon. Bradley is Clinical Trials Manager in the Department of Burns, Plastics and Clinical Care and can be reached with the contact details that you can see on the slide.